Well, welcome, Rotarians. I'm a little bit behind here because the timing on my quick clock or quickly just let me down. That piece, of course, is the wedding of Luis Alonso from 1897. I'm Fernando Sasueta. I'm pleased to be your president for this year, and I want to welcome all Rotarians and guests. There are no birthdays in July 22nd, so we'll dispense with that. And there'll be no inspirational thought for the day because we've got three committees that are reporting today, so we want to give enough time for them. If you have a guest, please enter their names and introduce them through the chat area, and we'll be happy to receive them, but we won't be announcing their names. We'll just be receiving them, and you'll be seeing them on the chat area. When we start with the program speaker, then I'd ask that you just send questions. Let's see. We're going to see if we can introduce some elements of what we used to have when we met in person, when we would ask people to stand if they brought guests, and we would announce their guests. But that's not happening, and that, of course, is a problem because that was one of the attractions to a lot of guests who did come in and were impressed with the sight of so many of us gathered together in fellowship, meeting to do good work in the community. Well, we can try something like that, but it's not the same. Just put their names in that chat box and we'll at least know that you invited some friends over. So welcome, Rotarians and friends. Let's get over to the blue badge status, people who have weathered the storm, served their duty in front of the flag as Red Badgers, and now are ready to become full-fledged members of our club. Here they are. Let's see, John, let's have that slide with the three. There we go. First one to show up is Dima Elnator. She passionately supports youth and works to help create success for them. At Apple, she manages its Music for Artists program and has a team in London that she used to before all of this happened. She's got a PhD in information technology, science and technology, and is an inventor, author, and a public speaker. She has several patents. The other one, Sara Cody, she's in the middle. She's got a Master of Fine Arts from Princeton. She's been the executive director of the San Jose Museum of Art for past 5 years and runs the county's largest arts education program for children. She says she puts the A in STEM so that you have arts involved with science, technology, engineering, and mathematics. Finally, we have Titus Lynn. He's an associate attorney with Grelis and Shaw, a boutique law firm where he specializes in early stage startups. But his daughter turns 1 year old on Friday, so he's been a little busy. Thank you and congratulations to these three talented and educated individuals who give so much credibility to what we do in our club. Now, in honor of Dr. Sara Cody speaking to us, we've invited to present the following Rotary activities. First up is Greg Kefferling, and you'll see his slide coming up as soon as John gets it in there. Greg is, of course, has been with Catholic Charities for 30 years, and the last 15 of them as its CEO here in Silicon Valley. Catholic Charities helps is helping during this COVID-19 pandemic, and they're critical aid to many of our neighbors who are often in need and without insurance. And he'll talk about our Rotary van donation. So, Greg, are you with us?
I am. Thank you, President Fernando.
All right, hit it.
Thank you, President Fernando and fellow Rotarians. First of all, I just want to say a big thank you to San Jose Rotary Club and San Jose Rotary Foundation for your continued partnership and support of Catholic Charities Santa Clara County as we respond to disasters. And Rotary came through during the flood of 2017, and now has come through again by donating this wonderful state-of-the-art vehicle that will transform and enhance our response efforts in the community, especially during the current pandemic, as well as in non-emergency times. So with this new mobile response van, San Jose Rotary and the San Jose Rotary Foundation is giving Catholic Charities the ability to activate immediately to respond to a disaster and deploy within hours. And it's especially important when we can't provide as many services indoors, being able to have this van to go anywhere in the community, outdoors, where there is a crisis. And we provide that critical intake and service navigation, as well as being able to provide mental health services. And, you know, if we'd had a van like this during the flood response, I think we would have been able to get the survivors into hotels even a lot faster than we were able to do then. As our disaster relief manager said, this van is a dream come true. So it's really amazing. This van has internal Wi-Fi hotspots, laptops, LED flat panel electronic screen videos, a beautiful wrapping job, all of this together so that it can be flexible and responsive when there's a disaster. And then also ongoing community disasters like homelessness and the needs of people struggling with mental health crises. As we know, we've done this research through our food distribution as part of the disaster response, and found out that somewhere up to 78% of the people receiving food are expressing the symptoms of depression and anxiety. And being able to have mental health services available to people in the community quickly is going to be really important. So we look at the whole issue of the social determinants of health, access to food, to housing, to all of the social services. It's really critical to have that quickly out there in a community when they're struggling with a disaster. So a real big thank you to the Rotary Foundation, to Rotary, to Elizabeth Monley and Rotary's disaster relief efforts, Michelle Loxon and Sarah and Jeff with Mission Valley Ford Trucks, and Jonathan for sponsoring the wrapping of the trucks and of the truck, and Fernando. I just want to say thank you to you for your leadership in these trying times. You know, they say it takes a village to care for those in need. I say it takes San Jose Rotary. Thank you.
Well, thanks very much, Greg. That's terrific. You know, we're going to have kind of a ribbon cutting ceremony tomorrow. I think it's the 23rd at St. John, downtown on 3rd Street, to cut a ribbon to receive this van. It's a wonderful gift that our Rotary community has given to Catholic Charities, so that you can continue to do the wonderful work that you people have been doing so successfully for so many years. You've been at it, as I was introducing you, for 30 years and 15 as a CEO. That's amazing. Also, I noticed that we have our Rotary emblem on the van itself, so that's a very nice touch. It'll help each time that van rolls out there, they'll know that we had a hand in helping out. So thanks very much, Greg. Next up, we'll be hearing from Cindy George. Of course, she's the wife of our Rotary past president, Bert George. Sorry, Bert. She has been going on trips. She volunteers as a non-Rotarian, by the way, and going to other countries to help with cleft palate surgeries for children and adults. And she's been doing that on her own for a number of years. And she's, I think, at Gordon House right now to broadcast her delivery. Cindy, are you with us?
I am. Thank you, Fernando.
Oh, thank you. Go ahead.
Thank you so much for asking me to speak about Rotoplas, because it's my favorite subject in the whole world. Let's see, what can I tell you? First of all, Sandy Ellenberg gets all the credit for bringing Rotoplas to San Jose Rotary in 2002. So I'm grateful for him for that. I think we all are. We've gone on so many missions, and I just wanted to share with you some of the places we've been. Venezuela twice, which was just amazing, and right before they really got into a world of hurt politically, and they're really struggling, but they're beautiful, beautiful people. We've been to India, we've been to the Dominican Republic, we've been to Guatemala 3 times, we love it. We've been to Oaxaca, Brazil, El Salvador, and there are more that I probably didn't go on, but that's just to name a few. As I said, Rotoplas is my passion, and I think if you have been on a Rotoplas trip, it might be your passion too. It's just so fulfilling, and if I think about all the trips that we've taken, the missions that we've taken, if I had to choose my favorite one, it would be like choosing between my children. So I just can't. They're all so meaningful, each one with their different, they bring something different. But the one constant is the hope, the patience, and the love of the people in the country we're serving at that time. So it's just, it's been a tremendous experience. I became the chairperson of Rotoplas in 2014, and some great people came before me. Chris DeSalvo, of course, Sandy Ellenberg started, Chris DeSalvo, Kathy Wiley, and now I'm chairing. And this is a really challenging time to be chairing a traveling medical team sort of operation. So I'm not quite sure what the future holds. It might take a little time. I don't know if I mentioned that what Rotoplas does is cleft lip and palate surgeries. And we go for about 14 days, and through that time, these kids are assessed and have surgery and are healing, and usually leave the hospital before any of us do. It's just a wonderful, wonderful experience. I hope that someday anybody that's listening right now will think about joining a mission. So I was thinking today, what do we do going forward if we can't travel and we can't bring a medical team somewhere? And I think with this new normal comes new possibilities. And we have funds that have been donated by our fabulous supporters. And so in keeping with the mission of helping children, I think that I'm going to work with Jaime Chavez and Leslie Hamilton and really flesh out some sort of outreach in our own community that would help the kids here and sort of stay within the heartbeat of helping children.
Well, thank you very much, Cindy. That's valuable information. And as I understand it, you've had to pay for your own way, and that's incredible that you have stayed so long with this. Thank you very much for your service to our club.
Thank you, Fernando. It's been a pleasure. Thanks.
All right, next up is Rose Simmons. She's formerly with the American Cancer Society for 35 years, and she chairs the Rotary Committee, which gives primary health care services to local underserved residents with limited access to such resources. And there'll be a video after her brief remarks. Rose, ready to go? Come in, Rose. Unmuted, are you?
Unmuted.
There you
Sorry.
go.
Thank you, President Fernando, for the opportunity to share information regarding Rotary's Rotocare Committee. The Rotocare Committee supports the efforts of the San Jose Rotocare Clinic. The clinic was started as a service project in 1989 by Rotarian Dr. Mark Campbell and District Governor John Fisher. The clinic provides non-emergency medical care every Wednesday evening at the Washington Elementary School. The clinic provides medical care for people with the greatest need and the least access to health care. Patients are a mix of repeats and first-timers with a variety of conditions, including diabetes, hypertension, congestive heart failure, etc. Clinic patients are now receiving health care via telemedicine due to the COVID-19 pandemic. The clinic operates through the humanitarian efforts of volunteer Rotarians, physicians, nurses, pharmacists, interpreters, and support staff. The clinic employs a part-time operations manager. Medical and clinical direction is provided by volunteer Dr. Bruce Frombach, a retired Kaiser physician. The Rotary Committee supports the efforts of the clinic by providing stewardship for the Rotary's very generous donation. By recruiting local restaurants to provide dinners for the clinic volunteers. The clinic volunteers usually come directly from work to volunteer at the clinic. By delivering food weekly from the local donated restaurants, 7 of them, Cafe Stritch, Palermo's, Tomato Time, Giorgio's, Aki's in Willow Glen, Las Gatas Cafe, and Loaves and Fishes. When possible, please support them and tell them a big thank you for supporting the clinic. I'm very proud to share that on February 13th, 2020, the clinic was recognized at Stanford's Medicine 18th Annual Community Health Symposium. They received the Outstanding Community Partner Award for group and individual intervention programs for Latina women with depression. A special shout out to the Rotary Committee, Brad Barron, Candace Rooney, David Markham, Devin Conway, Karen Philbrick, Terry Austin, Julie Shaver, Michael Oliver, Leah Schoner, and David Davis. Now I'd like to share with you a brief video regarding the clinic.
Diagnosed most recently with breast cancer, and I was very lucky to have Rotacare. My emotions were going up and down. You know, I was really grateful that they found it, but then I was so scared. My next thought was financially, and I was very, very overwhelmed. Rotacare said, we're going to get you through this, no matter what it took, telling me that emotionally they were there for me as well. It was like you're in free fall, and all of a sudden you're caught by Rotacare.
Rotacare has made me feel secure, safe. I feel like I've got control over my body, so to speak, whereas before I felt like everything, any health issue I was having, it was just thrown to the wind. What am I going to do? Who's going to be able to take care of me? I feel so blessed to have found this wonderful facility in my community.
The impact that Rotacare is making in the community is profound, and we are sort of a safety net below the safety net to provide free care to people who otherwise would not be able to afford it. We keep people working, we keep kids in school, we keep people thriving in their lives and in their relationships, and by doing that, we keep the community healthy and, in my opinion, a better place to be.
There isn't a day that goes by when you're not made to feel really good about giving and giving back to those people who they don't want to be there. They don't want to need you as much as they do, but it makes you feel good because you're doing something for your community and the people that live in your community, and you see it evolve. You see the wellness. You see the people being able to go to work. You see the people that are able to support this wonderful community you live in. It's wonderful. It's a great community service. It really is.
It's been a lifesaver knowing that Rotacare is there, that it is available for people that are found in situations that they never ever thought they would be found in. I am extremely thankful for Rotacare because it saved my life.
We started with, Dr. Campbell, one individual who just started giving back, and with individual support and Rotary support and community support, it grew. And over the last years, we've still grown and attracted more volunteers, provided care to more patients than ever. My hope for the future is simple, that Rotacare wouldn't exist and wouldn't need to be needed. But as long as there is a need and people still don't have insurance, we will continue on to provide care to as many individuals as possible.
Thank you, President Fernando and fellow Rotarians, for your support to the San Jose Rotary.
Well, thank you, Rose. That was a fabulous video, and it really tells us graphically all the great work that your committee has done and has been doing for many, many years. I wanted to now just take a moment to remind everyone that the club dues should have been paid by July 17th. So if you haven't done so, please get them in. These dues are what help us do the work that we do by our committees. Also, there will be an anonymous diversity survey that will be sent out soon to get a baseline on gender, race, and ethnicity. So look for it. It probably will be sometime next month after I get the board to review it and see if we can get forward with that. So help us out, take that survey and send it back to us. Now, before I introduce Suzanne St. John Crane, let me just mention to you that if you have any questions for our speaker today, or any time that we have a program speaker, type it in the chat box, just questions, no more guest names, but just questions, and we can then be sure that we help the Rotarian who's hosting the speaker to gather those quickly. So now Suzanne St. John Crane, she's CEO of American Leadership Forum, and she's the program committee chair. She'll introduce Dr. Cody. Suzanne, ready?
I'm ready. Thanks, President Fernando, and greetings, Rotarians. Good to kind of see everyone today. We're honored and grateful to have with us today Santa Clara County Public Health Officer Dr. Sara Cody, accompanied by County Counsel James Williams, to talk about the enormous task of managing the county's response to the coronavirus epidemic. Dr. Sara Cody joined the County of Santa Clara Public Health Department 20 years ago, currently serves as both a health officer and director of Public Health Department. In her roles, she oversees 450 staff and leads more than 30 programs dedicated to providing services that prevent disease and promote health and equity for nearly 2 million county residents. She's also the chair of the Big Cities Health Coalition, which represents health leaders from the 30 largest cities in the country, who collectively serve 1 in 5 Americans. Prior to joining the county, Dr. Cody completed a postdoctoral fellowship as an Epidemic Intelligence Service Officer with the City Centers for Disease Control and Prevention. Who knew how handy that would come in? She graduated from Yale School of Medicine, followed by a residency in internal medicine at Stanford Hospital. Dr. Cody's been hailed as a hero, leading the rollout of the nation's first shelter-in-place order here in Santa Clara County. And the Mercury News described her as the Bay Area's Anthony Fauci, Santa Clara County's most essential employee, and the one who had to cancel her own daughter's high school prom. What a journey you've been on, Dr. Cody. Please join me in giving a warm Rotary welcome through your Zoom reaction emojis and actual claps to James Williams and Dr. Sara Cody.
Well, thank you. Thank you so much. Can you hear me okay?
Yes.
Great. Thank you so much for inviting me here today. And I'm so sorry that it can't be in person, but one day I know we will get there. I'm joined today by my colleague, James Williams, and we don't have that much time with you today, but what we would like to do is give you a sense of, what does the epidemic look like right here, right now in our own county. I'm then going to turn it over to James, and he's going to talk about our current strategy, our risk reduction strategy, how we came to that, and what it looks like. And then we would like to highlight for you some major challenges that we're facing now and possible ways forward that I think will come up in our Q&A. The first thing that I just wanted to say and wanted to make really apparent to everyone about something that I think distinguishes the County of Santa Clara and our response from the response in many other jurisdictions. And that is that we have really adopted a whole of government approach. I think it's been from the Board of Supervisors right on down, and it's affected every single department. We are all here. I'm actually dialing in from our Emergency Operations Center in the Office of the Sheriff. And so the whole county family is really leaning in to try to protect our community. I never have worked so closely with the Office of County Counsel as I have during the last several months, because much of our strategy has to, and the implementation of our strategy has to do with the issuance of health orders. And we try to be as thoughtful, careful, and detailed as we can in every health order. And that really requires the Office of County Counsel and the Public Health Department and rest of the county to work extraordinarily closely together. So thank you, James, for being here. I can't see your tile, but maybe if you speak, you'll pop up. James?
Yeah, thank you, and it's a pleasure to be able to join Dr. Cody and talking with all of you. And in addition to serving as the County Counsel, I'm also one of the folks who is serving as director in our Emergency Operations Center, and we've been able to work very closely together. And I would strongly echo Dr. Cody's comments about it really being an all-in, holistic approach by every aspect of our county government.
Thank you. So just to sort of take us to where we started and where we are now, as you all may or may not remember, back in January, we had our first travel-associated case. And at that time, we, tracked, we tested that person every single day, tracked every single contact, every single place that person had been. And then by the end of February, of course, we had what we then thought was our first case of community transmission, meaning someone with no travel history who became infected in our county. And now, of course, fast forward to mid-July, and what we're facing right now is a new resurgence of cases and a bit of a change in what we're seeing. So in our county, like in many other counties, what we're seeing is faster increases and more rapid growth among young adults. So the curves are the steepest in the 18 to 34-year-old group. Back in late April and May, when we had really crushed the curve, we saw pretty much the same rates among all age groups. And since then, we've just seen that the 18 to 34-year-olds have broken away from the pack, and their case rates are much higher than in other age groups. Secondly, we have seen since the beginning an increasing disproportionate number of members of the Latinx community becoming infected with COVID. We also see disproportionately higher fatality rates among Latinx community. The disproportionate representation is not quite so as marked in our county as it is in other parts of the state, but it is still here. When we look at where are infections occurring, so I've told you they tend to be younger and tend to be higher case rates among the Latinx community, we are also seeing a consistent trend with higher case rates in zip codes in East San Jose, as well as in South County. So the rates in the city of Gilroy are actually higher than elsewhere. And when we look to sort of see where there are concentrations of cases, we see that in San Martin. And not surprisingly, in addition to the higher case rates, we also see higher positivity rates. And we look at this across the county. So I know that statewide, the metric is if you drift above 8%, that's worrisome. We have drifted from a very stable 1 to 1.5% countywide up to 4% countywide, which feels concerning to us. The trend is not in the right direction. And in areas where we're seeing higher positivity rates, such as on the east side, the rates go up as high as around 6%. The rates are also higher, the positivity rates among those who are young. And so the big picture that I want to share with you is that while we do see the concentration of COVID in certain populations, the truth is that it is also county-wide. And the more our rates increase and the more county-wide it becomes, the more difficult it is to have a focused strategy in order to contain and to bring the epidemic back under control. And so, for example, while we have done, I think, a remarkable job at preventing infections and deaths in long-term care facilities, the more the rates rise around the county, the more difficult it is to prevent the virus from entering a facility and to keep everyone safe and healthy there. It also, as you might imagine, is beginning to have an impact on our healthcare delivery system. So when we first issued the shelter in place, it was for a number of reasons, but one of them was to protect our healthcare capacity so that patients with COVID or without COVID could get care when they needed it and where they needed it. And what we're beginning to see is that it's not just the increased number of patients coming in, but it's also the staffing. So for example, now that schools are going to be opening with distance learning and not in person, that of course has an impact on the healthcare providers who have children, and now their children can't go to school and they're trying to balance work in the hospital with distance learning at home. So the effects really do multiply. I think I'll just stop there at painting the picture of what we're seeing locally in the epidemic, and I'm going to turn it over to James to describe how we transition to a risk reduction framework and away from a sector-by-sector approach. James?
Yes, so I'm going to talk a little bit about kind of the approach that we've taken in terms of the health orders. And as all of you well know, when we started this process, we began with the shelter in place. Actually, if you step back before that, the first orders that were issued back in early March were bans on mass gatherings and events that would have a large number of people. But then beginning on the announcement on March 16th, with the order that then took effect that night, we had the shelter in place. And we have had kind of different iterations of that. But one of the things that became apparent as we began with phased reopenings, beginning first with construction and then extending to things like curbside retail and outdoor dining and so forth, is that at a certain point, the shelter in place really wasn't the right framework. And there was increasing concern about, okay, how, what businesses are exactly open versus closed and why, and how does that make sense, and kind of all these different rules that were associated with it. And we shared those concerns. And so we spent a lot of time thinking through what is an approach that we could take that would provide a framework that actually could be more uniform, easier to understand, easier to operationalize, easier to be consistent about, to really help set a new behavioral norm, a new set of core expectations that we could all collectively have as a community, regardless of the type of specific kind of business, and instead apply more broadly to activities so that we kind of created a new norm that would also be sustainable for the long run. And so that led to the development of the risk reduction order. And so I'll talk a little bit about that and the framework behind it, and also how it's ended up interacting with the framework that the state has and under which we have to continue to operate. So the risk reduction framework itself is really based on a few key principles that where there's quite a bit of reasonable consensus in the public health community. So one is that from everything we know now about COVID-19, outdoors is safer than indoors, that having more distance is safer than less distance, using face coverings is safer than not having face coverings, and limiting duration and volume of contacts is safer as well. And so these kind of core basic principles animated the framework and the rules in the risk reduction order. And those basic rules, with exceptions for certain higher risk activities and higher risk businesses, apply across the board. And those rules are strict face covering requirements, a strong emphasis on moving as much as possible outdoors, outdoor activities as much as possible, and having that face covering requirement be strictest in the indoor context, and having very clear social distancing protocols that have to be uniform across businesses and across sectors, and really placing increased emphasis on those as kind of site-specific safety protocols. Embedded within these social distancing protocols are density limitations that also apply consistently and uniformly across the board, and a number of other important provisions around worker safety and safety for customers and others who are visiting businesses or workplaces. These core principles then really inform what kinds of activities can be done safely, but also allow people to be entrepreneurial about how they can shift, adapt, or adjust their operations to conform with kind of these basic safety requirements. We also wanted it to be a framework that people could really then have a sense of uniformity, so that we all had consistent expectations from business to business, so that we all know we need to see these social distancing protocols, we need to see that check mark in every single business, that we know what the rules are around face coverings in every single activity that we're engaged in, that we know, what kinds of expectations around de-densification, around volume, capacity should apply across the board, so that it's not a whole different set of things from place to place, and so it's not a list of things that were open and a list of things that were closed. And the hope was that that's a framework that really is something that can create a new behavioral norm around these kinds of expectations, like I said, for many months to come, because COVID isn't going anywhere anytime soon, unfortunately. We have implemented this new risk reduction order. It does apply across the board here in Santa Clara County. We have been having tremendous success with businesses submitting their social distancing protocols, with being able to push out information, with providing education and outreach. But things have become a little complicated because of the interaction with the framework from the state. The state still does have a sector-by-sector type of approach, and in particular with the more recent announcements from the state around the closure of certain kinds of sectors due to the increase in cases, that's kind of overlaid on top. And one thing that's always been consistent throughout is the stricter of the two orders always controls. And so that means if there's a specific sector that is closed by the state, then that is closed by the state under the state order, and the local county order adopts that. And so that does mean that for now in Santa Clara County, there are a number of specific sectors that for indoor activities are closed. And we recognize that the kind of changing regulatory environment and framework has been difficult for everyone. I wasn't able to get my hair cut in the 48-hour window, and so here I am. But obviously, it's something that's deeply, deeply challenging if you own a business or if you need to access certain services. And our hope continues to be, though, that we're shifting as much as we can, certainly at a local level, but as much as we can encourage kind of more regionally and statewide to a framework that applies kind of uniform rules that deal with the biggest safety risks. But we do also have to acknowledge what Dr. Cody was just talking about, which is the fact that cases have been rising significantly, positivity rate has been rising significantly, hospitalizations significantly. We're doing a lot better than the rest of the state. But the situation in Southern California in particular, for example, but even elsewhere in the Bay Area, is really concerning. And so we've once again, for instance, in the EOC, begun renewed focus on things like hospital surge, healthcare surge, renewed focus on acknowledging that the growth in cases continues to be problematic. But we're not giving up on the risk reduction framework at all. And in fact, we are continuing to really work as much as we can with encouraging all businesses, all activities to be moving forward with that framework, moving forward with the social distancing protocols. They are required for anything that is open. But we really believe that it is the way that we will be able to sustain broad-based community behavioral changes that are needed to deal with and grapple with COVID for the many, many months to come. So I will stop there and turn it back over to Dr. Cody.
Thank you, James. I think what's become clear, and I can kind of see it in the chat, and I was reflecting on it as James was talking, one of our greatest challenges, and I think it has been all along and it's become even more acute, is the lack of a standardized approach across the state and across the nation. We really have been at this whack-a-mole for way too long, and we need to get at least a statewide plan. I think it was enormously helpful in the Bay Area that we had a regional plan and that we did it all together. It was easier for people to understand, easier for people to comply with, and certainly a lot easier to message. I mean, I just think even on our own county emergency operations center, people that are working on this response live all over the Bay Area, not just in our county. However, it's also increasingly clear that it's not our county demographics and our county epidemic is not just interacting across the Bay Area region, but in fact it influences across the state, and particularly along the east side of our county. In the Central Valley, lots of trouble. Case rates there are increasing really fast, just exponentially. We have a lot of workers who live in the valley where it's less expensive, work in our county. We also have a lot of families where part of the family lives here in our county, part of the family lives in the Central Valley. And so it really cannot be a county by county approach. That's kind of the key take home. And not only can it not be a county by county approach in terms of policies, and certainly anyone in the business community, you can all say how incredibly painful it is to have your business closed in one county and that type of business open in the next county. You know, that's hugely problematic, and frankly doesn't feel fair. So we desperately need, I think, a statewide approach. It's also just in terms of resources, right? So we all share not just our hospital systems, but in some ways PPE, lab reagents, just the very basic tools that we need to protect our population and to manage the pandemic. So, for example, there's been episodic shortages in the lab supply, and some weeks it has to do with the swabs. Other weeks it has to do with the viral transport media. Other weeks it has to do with specific reagents that are needed on the various platforms. It's always something, and it's a lot easier to manage that for a regional or statewide population. But at this point, we're still managing it county by county, as with the PPE supply. So I think that is really our biggest challenge going forward, is to develop if not a statewide approach, a regional approach that probably needs to be larger than just the Bay Area region. So that's my vision for the future. Again, I think that the people living in our county made tremendous sacrifices to drive the infection rates as low as they were in May. And we went through, as I'm in the EOC, and I'm sure elsewhere, a tremendous period of mourning. There were literal tears shed on many days to see the good work that everyone was doing and feel like it was slipping away with our case counts rising. And I want to make one more point before we turn it over to questions, which is that we and I have been criticized for focusing only on COVID. And I think it's the perception is that it's not been a holistic approach. But I want to sort of give you a little bit of insight into my brain and the way that we are thinking about this, which actually is in a holistic way. And our idea, which if we had been an island, I think it would have worked a little better, which is that we were going to make a huge sacrifice. We were all in for a shutdown and for mitigation. And then on the county side, we had all of our PPE, all of our lab testing, all of our contact tracing ready to go to be able to put out every ember as it came, so that we could get life back to pretty close to normal, so that every business could open, so that every child could go back to school for in-person education. So we were going to make a huge sacrifice in the short term to be able to get the economy back on track, get education back on track, et cetera, et cetera. The problem is that we are not an island, and we are connected to all the communities around us, and so now we have to think about it. We have to think about it differently. And my concern is that if we don't get a larger collective to come together and all row in the same direction, we are going to be doing whack-a-mole for a very, very long time. But we are a creative and an innovative bunch here in the Valley, and we have a lot of energy, and we will not be deterred. So join us.
Thank you so much, Dr. Cody. Thank you, James. So appreciate everything you shared today. And there's about 1,000 questions for you, so I hope you have to know. So I've tried to summarize as best I can, and we're just going to try and knock these out and get through these as best we can. The first is really about testing and contact tracing. How do we improve the turnaround time, right? Because a test taken and then you get the results 11 days later really is not super effective, right? How do we improve the testing and the system of contact tracing?
Right. Effective contact tracing, you are absolutely right, depends on rapid turnaround times. And so we have kind of looked across almost way back in the day. I used to do foodborne investigations and HACCP, hazard analysis critical control points, when you look at a safety of food prep. So the first thing is that that as soon as a person, if you take it really far back, as soon as you know that you've been in contact with someone who is a case, you need to get tested. That's important, and that test needs to be available. So we have to work on testing availability. Or if you don't know you've been in contact, but you develop any symptom of COVID, you need to get tested right away. And that we are working on public education and education of the providers to make sure that happens, right? Because they're trying to shorten the time that you're running around infectious in the community. And then we need to shorten the time of that you get the test result back and that you know your results so you can rapidly isolate and rapidly go through your list and identify your contacts. And then those contacts, again, testing needs to be really easy to access, and it needs to be open to everyone, super easy to get. No, make an appointment, wait for the appointment, go in for the appointment. It has to be done like we do mass vaccinations. We have to do it like mass testing. And we can talk more about this, but one of the issues that we recognized well over a month ago was that the county was doing an enormous amount of testing, multiple times that of any other. And this is, like a screening test. And we would no more expect the county to screen everyone for their hemoglobin A1C to see if they had diabetes. Why should patients not expect that their providers will screen them for COVID as well? And so it's really, really, really important that the healthcare sector get on board. But of course, the healthcare sector is struggling, as everyone is, with the reagents for the lab. So it's a very large systems problem.
I appreciate that answer. And then in terms of the vaccine, of course, that's on everyone's mind. How many people will be effective for a clinical trial? How much time is this going to take? And will people be exposed purposely to test efficacy?
So I can't give you much detail. I know on vaccines, of course, there's a number of different vaccines that have been considered, and they all work in different ways, and they're all in different periods of testing, different phases. So, one challenge, of course, is to get a vaccine that's effective and that can be produced at scale for all the different, everybody in the world who needs to be vaccinated. But we also have work to do ensuring that there's readiness to accept the vaccine. And that's work that we need to get started on now, because it doesn't do any good to have a vaccine if you can't get the majority of the population to accept the vaccine. And this is particularly important in populations and groups of people who are at higher risk, both for infection and for poor outcomes. And so I think in our county, that would be the Latinx community and the African American community. And there's a lot of distrust of government and of vaccines, frankly, in many communities. So that's something that we need to get started on. And that's something that we can do in our community. We're not manufacturing vaccine, but we can work with our community and make sure that we're ready to receive when the vaccine's available.
And a few folks have brought up certainly the small businesses that have been closed for 4 months, and it's just been this ping pong, right? You're talking nail salons and barbers and whatnot. We seem to keep punishing the same small businesses who can't open, but haven't contributed to the spread of this disease. What do you see as the solution here? How quickly can these places open?
James, you can probably, I would say that this is precisely why we moved to a risk reduction order, so that we weren't picking and choosing before businesses. We're setting out, this is what we know from a health point of view about how to prevent COVID and how to keep people safe, and we can apply it across. James?
Yeah, I would absolutely echo what Dr. Cody just said. I mean, that's really the genesis behind the risk reduction framework. Set across the board uniform safety standards and, call on the ingenuity and creativity and entrepreneurship of our businesses to have their operations adjust to meet those necessary safety standards, whatever the type of business, whatever the type of service. And so that is the kind of foundational framework behind that order, and that's where we're at in terms of our local health order. But of course, we do have to abide by the state framework as well.
And what are the factors that are driving the disproportionate rates in the Latinx community? Could either of you speak to that?
Yeah, I think there are a number of factors. One is in many of the neighborhoods where there's a large number of people from the Latinx community, there is also a lot of very dense housing. So apartments where a very large family would live, a multi-generational family. There's also a disproportionate number of people from the Latinx community who are working in essential service jobs that are public facing. So, in retail or a grocery store clerk or a transit driver, where there's just more opportunity for exposure. So that gives you a higher probability of being infected. And then if you come home and live in a household that's more crowded and with more people, then there's a higher probability and more opportunity to spread. And then those family members who also need to go out and provide an essential service, then the chains of transmission continue. So I think those are really the primary drivers. And COVID is this incredibly smart, adaptable virus that seems to take advantage of every single little opportunity that us humans give the virus. This virus takes advantage of it. And because there is so much spread before people become symptomatic or while they're asymptomatic, it's extraordinarily difficult to control.
Appreciate that. And certainly several questions about education as a parent. I can agree it's on everyone's mind right now about what do we do and how does equity play into that in terms of access to internet and, folks that have the privilege of getting their pods together and take turns teaching versus those that are working full time. Can you give some detail too on the differences in educational delivery between, say, special needs kids and more mainstream students? How does the county balance all of this and recommend and come up with an equitable plan?
Well, this is one of the issues that just makes my heart ache, and it just makes my heart ache, and I think this is like why when we saw we really crushed things and we saw our numbers go up, one of our first concerns was that we were going to jeopardize the ability of schools to open for in-person learning. And the cascading effects of that are, we feel it. It's difficult to describe. So, if nothing else, if we could really just get behind crushing the curve again to enable education, I think that's a fairly high priority for a society. But now we're kind of into the weeds of how can we make something safer, or how do we make trade-offs. And we are working very closely and have been since the beginning of the pandemic with the County Office of Education to try to understand those trade-offs and make the best possible decisions. And they're really, really hard. One thing I will say is we have an assistant health officer who is completely dedicated to understanding the literature around how the virus behaves in different age groups. And working with colleagues from around the Bay Area. And we came to the conclusion that the risks of the virus spreading in younger age groups, particularly 10 and below, is quite a bit lower. So middle school and teenagers behave a little bit more like adults, and younger children are less likely to spread to each other and less likely to spread to an adult. So it's not like flu, doesn't work like flu, which is good. So we actually think that with a lot of safeguards in place, elementary schools can consider in-person learning. I mean, it needs to be small, stable cohorts or little pods with a teacher. And there needs to be plenty of ventilation and mask wearing, et cetera, but we think that it can be done. And the state, in fact, has offered a process where elementary school districts can apply for a waiver in order to enable in-person learning. And we are ready and willing to work as hard as we can with districts who wish to do that.
Thank you very much. I have to interrupt because our time is up. I can't tell you how much we thank you, Dr. Cody, for speaking to us today. The committees with medical orientations were arranged in your honor because you were going to be our speaker. Also, a contribution has been made on your behalf to our city forest to plant 46 shade trees in East San Jose, an area which desperately needs them to fight heat islands, air pollution, and neighborhood predation. So we want to thank you so much for coming to talk to us today, Dr. Cody.
Thank you so much for inviting me. And again, I look forward to meeting you all in person one day.
So do we. Next week, we have Don Hyder speaking on the Vatican and artificial intelligence. He's the CEO of Markula Center for Applied Ethics and artificial intelligence and also he's a communications professor at Santa Clara University. That's a Jesuit school, so maybe he has some special perspective on this issue. So tune in next week. We haven't had too much to smile about with this COVID thing, but guys, if you're listening, laughing at your mistakes can lengthen your life, but laughing at your wife's mistakes can shorten it. So that's it. Hasta la vista, Rotarians. Zoom meeting stands adjourned. Thank you very much.
Thank you, Dr. Sara.
Thank you all.